Now, family practice, we see a lot of stuff. You see a lot of stuff, and one of the common things we see is joint pain. Which joints, and what do you do with it?
Well, there's all kinds of joint pain that we see, some from trauma, some from arthritis, some from rheumatoid arthritis. Arthritis is one of the leading causes of disability in America, and there are many causes such as obesity that can lead to the development of arthritis, injuries, wear and tear on joints from certain occupations, poor physical health, poor dietary consumption can all lead to joint deterioration.
Now, before you get to medicine, what are some things, you mentioned obesity, so obviously diet, but what are some things you can do to relieve joint pain?
Well, things you can do before you come see us would be to certainly ice and elevate the joint. If you have a swollen, painful joint, you can take over-the-counter medications like Tylenol, Aleve, ibuprofen. But if after 48 hours you're not seeing any relief, you probably should schedule an appointment.
Okay, now there are types of arthritis, different types.
There are.
Give me some ideals.
Well, there's osteoarthritis, which is typically caused by wear and tear on a joint, and then there's rheumatoid arthritis, which is an autoimmune disorder affecting multiple joints throughout the body.
And there's also gouty arthritis.
And there is gouty arthritis.
Give me an example of that. Where does that stem from?
Well, gouty arthritis comes from an excessive amount of uric acid, a chemical commonly found in synovial joints in the body. As it crystallizes, it kind of forms some inflammation in the joint and can lead to long-term debilitating arthritis.
And big toe is a common place.
The big toe is a common place.
All right. Now, I see a lot of people with knee pain, pretty common. And you mentioned weight loss. You know, they say if you lose 1 pound of weight, it's like 4 pounds of pressure off your knee. So weight loss is very important. But there's also some prescription medicines you can take to improve arthritis.
There are some drugs we call NSAIDs, or non-steroidal anti-inflammatory drugs, work really well. Diclofenac, naproxen are some. There's a prescription strength ibuprofen we use. There's medications called salsalate that we can use initially. There's also some drugs that are a little bit more easy on the stomach, because with NSAIDs, you certainly worry about kidney function in those patients.
So can also aggravate your stomach.
And can upset the stomach and lead to ulcers. So there are some medications like meloxicam that we can use that are a little bit easier on the stomach. And then there are joint injections. We can certainly use corticosteroids or glucocorticoids to help treat arthritic symptoms.
Now, if you're on an anti-inflammatory, are there some medicines you can take over the counter to protect your stomach?
There are. You can take certainly some of the stomach medications like Prilosec or Prevacid or Nexium. Tums certainly can relieve your symptoms.
Okay. Now, you mentioned steroids, cortisone, and then with rheumatoid, there's also some newer immune suppressant medications. Those are medicines you really ought to see your doctor about and kind of really know what you're treating because of potential side effects.
That is correct. We certainly want to be, we don't hand out steroids real freely because of the potential side effects from that. And a lot of patients come wanting joint injections or just give me a steroid pack and that'll fix this because it helped grandma. So we certainly want to be careful with those. There's a lot of considerations. With diabetic patients, certainly it's going to elevate their blood sugar, so we have to monitor that closely.
Well, that's